There's a battle continuing in leadership for the Sunshine State. It concerns money spent to promote the state and differing values about the return on investment to taxpayers.
Jacksonville is kind of emerging now as one of those markets. And it's emerging for a number of reasons. And that's because what the tourists are now looking for.
While great things are happening in tourism for Northeast Florida, a struggle is happening in Tallahassee. The Visit Jacksonville CEO weighs in. Plus, improving health in our communities, the latest studies and the latest science, with 2 doctors leading the charge in their specialties, all part of This Week in Jacksonville. Thanks so much for joining us this morning. River City showing some pretty interesting signs of growth. Visit Jacksonville says that the latest numbers show that tourism set another record, 40 months of consecutive growth. That's from the Smith Travel Research Report for February. And February numbers even beat Super Bowl 39 numbers going back to 2005. The report says there were 382,050 hotel rooms sold that month, comparing that to Super Bowl numbers when just under 350,000 rooms were filled. Hotel revenue brought in $35.1 million, and so Visit Jacksonville saying that the marketing campaign targeting nature and sports lovers, along with a revamped convention sales efforts, really making a difference. So joining us this morning, someone right in the middle of those efforts, the CEO of Visit Jacksonville, Paul Asselford. And so there are some things to celebrate, and we want to talk about those. Some things that might be a little frustrating as well, so we'll get to that. Talk with me first about some of these growth numbers that we just displayed here. Jacksonville growing tourism faster than other cities in the state of Florida, right?
Not every city in the state of Florida. Jacksonville is growing faster, but also almost every city in the nation. And I'm talking about growth numbers here. I'm not talking about where occupancy is. Yeah.
Okay.
Because if you compare us against Miami or Orlando, their average rates and their occupancy, well, occupancies sometimes are even below where we are right now. But overall, our growth has just superseded every one of those cities, and we're pretty proud of that.
I bet. So dive a little deeper with me. What are the factors, what are the components that have drawn more people to Northeast Florida?
And actually, our research shows is that people are looking for what I'd call more authentic kind of destinations where they can explore and have experiences in that they might not be able to do in other places. There's a big difference between the Disney aura and nature wonderland that we have here in North Florida, where you're talking about the waterways, the incredible waterways, and everybody knows about the beaches and the Intracoastal and the St. John's. But the issue is, what kind of experiences can they have on that? And that's what we've been promoting, and the millennials love it.
I bet. You're seeing a promotional video from Visit Jacksonville right now called Elevated Jacksonville, and obviously it shows a lot of different experiences that people can have here. Also, we've got some promotion that you're doing about Jack's culture, that there are these different cultures. Are you hearing good feedback from that?
We are. In fact, the whole issue of even what you're talking about, arts and culture, and how that is different than other places that they go to. The idea that we can actually be a genuine destination that is differentiated, and that's our whole objective. That's what we're trying to do, and it's working.
Yeah. So let's talk about something else here. The battle over Enterprise Florida, which markets the state to businesses, that continues. The House recently during this legislative session voting to eliminate that program. The Senate doesn't have a companion bill, so the Senate budget with over $80 million for EFI, pretty close to what Governor Scott wants. Let's talk about a specific component there, though. When it comes to Visit Florida, that's the organization that markets the state and then draws in tourists through ad campaigns. The House proposed $25 million. It's only about a third of what the governor wants. And here's what Governor Scott actually said in a recent commercial. He said, if the politicians in Tallahassee say they don't want to market our state and we lose tourists, then we lose jobs. If we lose 2% of the jobs in tourism, that's 28,000 jobs.
That's just 2%.
And I'm going to ask the dumbest question you've heard yet today. Are you in favor of keeping Visit Florida and funding it the way Governor Scott wants to?
Well, let me think.
Yeah.
Yes, I am.
I thought you would be, yeah.
Bottom line is that organizations and destinations like ours, I'm talking about Jacksonville overall, have been benefiting tremendously from what work that Visit Florida has done, because they are actually out there trying to present the different sides of Florida than most people have in their minds. And so Jacksonville has gotten a lot of support from Visit Florida over this past couple of years. And I don't know what we'll do without them, because we don't have the kind of budget where we can actually touch the international markets like they have helped us do. That kind of marketing and support is going to be essential for destinations like ours.
Well, so, and not my role to take sides here. The other side, House Speaker Richard Corcoran says he considers business incentives, that's kind of the enterprise Florida stuff, as corporate welfare. But he's attributed growth in Florida's tourism to an improvement in the economy and then people having more disposable income. He also says, hey, great businesses like Disney are already focused on bringing people to the state. So shouldn't we look at a possibility for taxpayers to get some more money back in my pocket rather than paying for this?
I have no problem with any government entity taking a look at really scrutinizing where government dollars are spent. If, however, those what I'll call political professionals, if they don't know about the industry, if they don't know what the competition is doing, if they don't know that all the states that are watching what's going on in Florida right now, many of them are actually talking about increasing their budgets because they see an opportunity to take business from Florida. And if you have studied the industry at all, you can see where every, what I'll call state or municipality that in the past has cut their budgets for what I'll call good reasons, right, every one of them has eventually gone back to putting money into the selling and marketing of those destinations, because they got crushed by other destinations who understand the value of marketing their destinations and the competitiveness.
Yeah, well, Paul, I appreciate it. I know we've got a few more weeks here, the legislative session. We'll see where this really lands in terms of appropriations and the budget for Visit Florida. Paul Asselford from Visit Jacksonville, thanks for your time.
Thank you, Ken.
All right, so no excuse not to exercise when you live in a place without snow. At least that's the thought. Up next on This Week in Jacksonville, we're going to talk about 904 Mission 1 million and the future of healthcare here in our area.
What kind of donor are you? You donate everything all at once every year. All of it has to go. However you do it, just donate. Donate, shop, jobs, good things for North Florida with Goodwill.
When we place our loved ones in a nursing home, we expect them to receive the best care. We meet with families who learn that their mothers and fathers, grandmothers and grandfathers have been terribly abused in nursing homes. Bed sores, malnutrition, broken bones, dehydration, and yes, even death. I'm John Morgan of Morgan & Morgan. If you believe that a loved one has been abused or neglected while living in a nursing home, call us. The consultation is free. Morgan & Morgan, for the people.com.
You can drive a truck, or you can team up with one. The 2017 Nissan Titan. Go the extra mile in a truck that has better acceleration, handling, and braking than Ford F-150. Take on any job. The newly redesigned family of Titans, featuring America's best truck warranty. 5 years, 100,000 miles, bumper to bumper. Get to your local Nissan store today and save $10,000 on the 2017 Titan XD.
Tallahassee politicians want to stop marketing Florida and competing for jobs.
The politicians in Tallahassee don't get it. They don't understand how jobs are created. If the politicians in Tallahassee say they don't want to market our state and we lose tourists, then we're going to lose jobs. If we lost 2% of the jobs in tourism, that's 28,000 jobs. The politicians are wrong. There is not a job that's expendable. Every job's important. Florida will compete.
Sponsored by Let's Get to Work.
News 4 Jax at 4. News when you want it.
Local stories and breaking news alerts from your neighborhood.
Your forecast first at 4 on 4 on TV and streaming online.
News 4 Jax at 4. All new, 52 weeks a year. You're watching This Week in Jacksonville with Kent Justice
And we just heard how Northeast Florida is winning when it comes to tourism. When the target turns to health and wellness, doesn't seem to be going quite as well. And that's one of the reasons Jacksonville Mayor Lenny Curry launched an initiative called Journey to One, and the Duval County Medical Society Foundation started the 904 Mission 1 Million campaign in partnership there. So joining us now is Dr. Sunil Joshi, president of the foundation. Good to have you with us again.
Thanks for having me.
You've been on our show when I haven't been here, so this is good. We get to see each other face to face. So these new numbers are out, and I think in general show that there's still plenty of work to do, right?
Well, yeah, unfortunately the numbers show that we've dropped again. So we went from 48th out of 67 Florida counties last year down to 55. And in the last segment, we talked about all the things that are so good about Jacksonville and Northeast Florida, and in particular for your health, yet we keep falling in these rankings, and that's made us very, very concerned.
Yeah, let's show that if we can, what you just mentioned there. 55th out of 67 counties, and really that ranking comes out of the premature death rate. Why don't you explain that for me? And you see the numbers, I put them up here that you gave me here.
Yeah, this is very important information. So why are we 55th out of 67 counties? And the way they come up with those rankings is based on health outcomes that are all entirely based on premature death rate. So we are expected to live in this country to be 75 years of age. If you live to be 65, that's 10 years of life lost, and that goes into that premature death rate. If you die at 25, that's 50 years of life lost. In 2016, we had 8,700 years of life lost per 100,000 population here in Northeast Florida. The state average is only 6,700, so you can see why we rank where we do.
Right. Are there some easy to understand reasons for why that loss of life?
And unfortunately, there are some easy to understand reasons. In particular, the violent crime rate, our infant mortality rates tend to be towards the top here in the state. In fact, we had 645 deaths per 100, or violent crimes per 100,000 population here in the last year, and that is above the state average, which is only 500. So right there, you could see where that would impact.
So, and this last bullet point right there, younger people tend to be victims, and it increases the premature death rate. So does it? I'm just playing devil's advocate. So does that skew that number we just talked about?
Well, it certainly does. It certainly does skew the number, but it is very important in calculating the health of a community, right? So someone who dies at 25 is not good for anyone in this community. We just lost 50 years of productive life from Northeast Florida. So yes, it skews the numbers, but they're there, and that's part of the ranking.
Yeah. One thing I thought was interesting, you guys looked at, or part of the study, looked at commute time. And in some ways that's time lost, but it's because you're not really productive. And here it is, 31% of the workforce driving more than 30 minutes to and from work, I would suppose. That's lost time of productivity, but there's another impact, right? It's less time that I'm being active.
That's less time that you're being active, and more likely for you to come home and just want to crash on the couch after dinner. And so they looked at
I'm just confessing right
now. That's right. So have all of us. Okay, and so you look. They were just looking at 30 minutes. Those of us who live in Northeast Florida know that it may be much more than that. Every hour after the first 30 minutes that you're in your car driving to or from work increases your risk of obesity by 6%. And so obviously we have very long commutes in Northeast Florida. People live in St. Johns County but work in downtown, where they're automatically driving for 45 minutes to and from work each day, and they're suddenly at increased risk of developing obesity.
Yeah, there are some things that might be able to change that, right? We've got some development on the South Bank here that's going to kind of focus on healthy living or healthy lifestyle.
Absolutely, and so what's going on with the district on the South Bank and some of the lower cost housing in La Villa is where you're building a neighborhood basically that's centered around living well, and there's grocery stores and restaurants and places to shop, so people don't have to get in their car to go to work or to go to get healthy food options. You can just simply walk there. More like the old urban centers used to be, which is why people used to be healthier in this country than they are now. Most people are living and driving, living away from the core and driving into neighborhoods. And we want to try to change that if we can.
Yeah. Let's talk, shift it just a little bit here. I know coming up pretty soon is the Future of Healthcare Conference, and we can show that information right now. It's going to be held May 22nd and 23rd, UNF. So explain this for me, because I understand it's kind of focused on healthcare disparities in Northeast Florida, and has a component here also ties into Mayor Curry's Journey to One.
That's right. So basically, the mayor has this all-encompassing vision for the health of Northeast Florida, which has multiple different roles to play. And so our Future of Healthcare conference is going to look at each of those, but not only to identify the areas of concern or to identify where we have disparities, but to ultimately come up with solutions and do something about it. So we want to have public policy that comes out of our conference that can be supported by the city and the city council and actually be put into action. And one of the areas that we're going to focus the most on are the food deserts that we have in Northeast Florida. Believe it or not, we have people who live in this county that have to drive over 10 miles to get to a restaurant, or get to a grocery store, I should say. And that's unacceptable. There are parts in Jacksonville where we live where there are 3 grocery stores within 1 mile. Okay, and so there's where the disparity comes into play. That's also the part of town that has the most obesity, that has the socioeconomic concerns, and has the violent crime issues. If we can figure out a way to incentivize marketplaces, and particularly grocery stores, to come into those areas and provide at least 60% of their product being fresh fruit and fresh foods and produce and deli type items, then not only are we providing healthy food options for these communities, we are very likely providing jobs and health insurance and improving the infrastructure, all of which goes to improve the overall health of a community. If we can do that in multiple locations around town, we can actually start to make a difference with these numbers and not just talk about it.
Yeah, so we'll wrap up on this, about a minute left, but one of the things I found interesting, that public policy component, you're going to have JU's Rick Mullaney there as part of this conference. And the idea is to get some guidance on how to create good public policy surrounding that?
That's right, and we're going to use Rick's expertise to help us write the policy, and then hopefully help us push it through the appropriate sources to get this done so that we can actually make an impact.
All right, Dr. Joshi, appreciate it. Interesting to hear about the challenges, but love to see that we're going somewhere to try and create solutions.
And that's what we have to do here in Jacksonville.
Thanks for your time this morning. So more about health in our part of the state coming up in this next segment. A unique event is about to happen. Mayo Clinic's Dr. Q joining us and explaining the partnerships and the purpose behind the Brain Tumor Awareness Social. Stay with us on This Week in Jacksonville.
At Longhorn, tonight's special steakhouse cuts, featuring for a limited time the new Delmonico ribeye, our tender flows filet, and the juicy New York strip. And for lunch, try our steakhouse burger or any steakhouse lunch combo. You can't fake steak.
Come on, open up. It's good for you. Just eat it. It's good for you. It's good for you. Colonoscopy prep. We'll drink up. It's good for you.
A Borland-Groover Clinic colonoscopy isn't just good for you. It could save your life. With our advanced technology and personalized patient care, you can count on Borland-Groover for exceptional care inside and out.
Good sir, dost thou question the might of Purolator?
I'm not questioning the might.
Thine engine shall be protected up to 15,000 miles. Nothing gets by Purolator, nor Sir Hammond of the East.
Cool.
Nothing gets by Jacques either. You must choose this one because nothing
gets by Purolator. Got it.
Get back to being yourself. Back to smiling and laughing again. Back to eating foods you love. Back to living confidently. With same-day dentures backed by our satisfaction guarantee. And for new patients, a free consult and x-ray. For affordable dentures, extractions, and implants, call 1-800-DENTURE or go to affordabledentures.com. You deserve a healthy, beautiful, and confident smile.
When you've been in an accident, you're going to have a lot of questions. After making sure that you and everyone's okay, call Harrell & Harrell. We will have the answer to all those questions that you have of what you need to do afterwards.
Harrell & Harrell. Don't settle for less than you deserve.
Mayo Clinic making a difference once again, and in this case, they're making people aware of some incredible stories involving people fighting brain tumors. Our friend, Dr. Alfredo Quinones-Hinojosa, joining us. This is Dr. Q. It's easier to say. Thank you very much. Also the chair of neurologic surgery. And so you're really one of 3 hosts of this event coming up this week called the Brain Tumor Awareness Social. So, Dr. Q, what is that?
Well, this is an attempt that actually not only our Department of Neurosurgery, but also the Department of Neurology, led by Dr. Mesquia, and the Department of Oncology, led by Dr. Chanankan, we got together and we decided that we wanted to do an event for the first time where our intention is to build bridges with a lot of patients that are every day struggling with some sort of cancer. In this case, happens to be brain cancer.
Do those patients need support from other patients or to know that other doctors are on their side? What do they need?
You know, I do believe, and we all of us thought that it was important for them to realize that not only there are other patients that are struggling with similar things, so they get to share their own experiences, but I think it's important for them to realize that there are young people, there are faculty members, there are scientists who have dedicated their life to find cures for the diseases that affects them. And I think that gives them hope, Kent. And I think that for us, the idea of giving hope is so extraordinarily important.
When someone gets that initial diagnosis, when they know that they're going to have treatment, they may have to have surgery on a brain tumor, is there a lack of hope? It's got to be very, very difficult, right?
I cannot tell you that I know exactly what it feels. All I can tell you is that I deal with all my patients because I specialize in brain cancer and I take care of the most complex brain tumors you can possibly imagine. And I see it in my patients all the time. When you're given that diagnosis that you have a brain tumor, you don't know if it is benign or malignant. All you know is that you're told that you have a disease that can potentially be terminal.
Right.
And that, you know, sort of lack of hope many times can have very, very severe consequences in your overall state of health. And I think for us, it was important to go ahead and try to build bridges with our patients.
Yeah, tell me about some of the bridges here because you're collaborating, as you mentioned, with neurology, also the Mayo Clinic Cancer Center. Do departments like this cross borders often, or is this unusual?
I think it's not unusual at the Mayo Clinic because we decide the way that we take care of the patients is we look at service lines, we look at diseases that affect patients. In this case, brain cancer is not a disease that only the brain surgeon has to deal with. We also have oncologists, we also have neurologists. So for this particular event, we decided to cross-contaminate, come together to give these patients hope. And I think that that's the way we function in humanity.
Yeah, well, I think this is really going to be interesting because I know part of the program, if you will, is to have some of those stories told about people who are going through that battle. That's got to be invigorating for your medical staff as well, right?
It is amazing. Remember that day? Well, you're going to be part of our program, and we're going to have an amazing story, 2 stories by patients. We're going to come and tell the story, their family members. And that, to us, is equally important. That gives us, as faculty members, as staff, as scientists, it gives us the energy so that way we can go back to the laboratories, we can go back to the clinic and continue to try to find cures for them.
Yeah, so I was just mentioning to Dr. Joshi, who you last segment and you got to meet, that one of the things that was compelling our first time we got to meet was that you said, we are going to find cure. So where does that stand? And obviously, you're a very focused individual when it comes to talking about cures.
I think that we are undoubtedly closer. At the Mayo Clinic right now, not only do we have the largest amount of NIH funding in brain cancer through not only my laboratory, but a new recruit that we got into neuro-oncology, but also we are right at the edge of opening about 3 clinical trials that are going to help patients with brain cancer. So if you can imagine, these are the things that are going to allow us to get closer and closer to find cures for cancer.
So that added funding allows to do some of the clinical trials that you're talking about. But as I understand it, more funding to the NIH or to an institute or to Mayo means more researchers are going to go, more talent is going to come toward that problem, right?
That is undoubtedly our objective. As you know, Dr. Farrugia, who's our CEO, is committed to recruiting many, many more scientists and physician scientists like myself, and that takes a tremendous amount of effort and resources. And that's exactly what we're doing, and we're committed to that. And having more of these grants through the federal funding allow us to bring more talent into the community.
Yeah, concerning to you at all with the budget process that's going on in Washington? I know you said you'd met at some embassies recently, but initially it sounds like the new budget would not put as much money towards research into the NIH.
We are concerned, Kent, and I think that it is the time for us, because remember, this is our money, these are our resources. We definitely need to make sure that our leaders understand how important it is to use more resources for science and innovation.
Yeah, it's pretty important. So let's talk just a little bit more about the Brain Tumor Awareness Social. I want to show you some information on the screen here. It's taking place this Tuesday evening. It's in the Kinney Auditorium, and that's in the Kennedy Building at Mayo Clinic. So that's San Pablo Road. Begins at 6 o'clock, goes until about 8 o'clock. And I guess the last thing I would ask you there is, should people be prepared for, is it a fundraiser? And is there room for more people to come?
There's always room for more people, and it's not a fundraiser. This is at no cost. This is an opportunity for our community to come in, share some of their experiences with us, for us to share some moments, and for us to learn from them. We're going to have a lot of young people showing their science outside through posters, and then inside we're going to have a very short program. We want to make something exciting, and we want to build bridges with the community.
Yeah. Are you looking for the younger folks or people who are going through this battle right now? Who are you looking for to attend?
A combination of both. Remember, when a patient has brain cancer, it's not just them going through the disease, it's also their family members, it's their loved ones. So we want the combination of all of those. We don't look at patients in isolation, we look as a unit.
I appreciate it. Dr. Q, always a pleasure to get to visit with you. I'm honored that you asked me. I'm going to MC that get-together on Tuesday night. I'm looking forward to it.
Thank you, Kent.
This Week in Jacksonville airs each Sunday morning at this time. Congressman Ted Yoho is one of our guests discussing the roadblocks for President Trump, even by Republicans. That's coming up. We're also going to look at his priorities as a U.S. representative from Gainesville. I'm Kent Justice. Thanks for watching.
More people in Northeast Florida and South Georgia get their news from News 4 Jax than anywhere else.